welcome to Logical Ayurveda. Today we are going to discuss a topic on medicines, two medicines, that is one Ksheerabala 101 thailam capsule and Gandha thailam capsule. Happiness in clinical practice comes often from the satisfaction of doing the impossible, treating the impossible, than acquiring money or acquiring fame, acquiring power, etc. By impossible, I mean treating cases of chronic arthritis where the patient have made up their mind that it is impossible to cure their condition, that it is impossible to cure their knee pain, it is impossible for any doctor to cure their knee pain, and they have come to a stage of frustration. Happiness seriously comes from treating such cases and giving a miraculous difference to the patients where they thought it will be impossible to be treated by any doctor. If only we have proper understanding of using taila capsules, lakhs together of patients with chronic osteoarthritis can be cured and thousands of knee transplants will definitely be averted. So, one physician must give an unwavering concentration when patients tell about their symptoms of osteoarthritis and the dosha involved in that, and do a great analysis and choose a correct gel capsule. In fact, it only comes to how you select a proper thailam capsule in treating the knee. It only comes to that, because sandhi gata vata, sandhi is vatasthana and vata guna is basically ruksha. So how you choose a snigdha guna aushadhi opposite to ruksha makes all the difference in the world. So one has to be very thorough and with the understanding of where to give Ksheerabala, where to give Gandha thailam and where to give Tanvantram 101, and half of your practice is done. So Ksheerabala 101, it only contains milk, Ksheera, Bala and Tila. Only three dravyas. One is Ksheera, Bala and Tila. This aushadhi or this medicine is a giant miracle hiding in plain sight with simple ingredients. That is milk, Bala and Tila. Before telling this, I will tell an interesting story of how Ksheerabala intrigued me. I had the fortune of learning under a guru who practiced in OT, learning under an Ayurveda doctor who practiced in OT, where there are a lot of tea plantation workers. They have to walk uphill and downhill every day. They have to walk 5 to 10 kilometers uphill, carrying some weight, and downhill for their work, doing the coolie work. They used to have severe knee pain and tenderness with barely 100 rupees to spare for any treatment. They don't have medicine, they don't have enough to spend for food, let alone medicine. They are such poor, and they used to come to a Ayurvedic doctor whom I happened to learn from him. So my guru, when they entered the clinic, he used to smile at them, and they used to put on this sad faces and tell all the history of the knee pain and how tenderness came, etc., and how they walk 5 to 10 kilometers every day. My guru used to smile at them and give only Ksheerabala, which was then 2 rupees per tablet for a week, and Ksheerabala 101, which was then 4 rupees for a tablet for a week, and pinda thailam, plain pinda thailam for external application, and the prescription never crossed 100 rupees. No, what? After a week, patient used to come entering the clinic with the smiling faces to tell the story about how it cured their knee pain, how they are lot relieved, how they are capable of doing the work now with lot more strength in their knees, and how miraculously pain faded within a week, and it gave strength to do the work. So I had such beautiful experience with Ksheerabala. So coming to analysis of Ksheerabala is a Madhurasa Pradhana Dravya and Shita Snigdha, and it is Rakta Prasadana. It is mainly used in Mamsagata Vata Rakta, it is Ati Brahmana, etc. When you touch the muscle and the patient have tenderness and pain, the first drug that has to come to your mind is Ksheerabala. If you are working in suburban areas or labor areas where people do heavy physical exertion, like a patient is a coolie who lifts weights and goes, a patient is a vegetable vendor in a street with the vehicle who walks 5 to 10 kilometers or 15 kilometers per day, first thing that has to come to your mind is Ksheerabala 101 and Ksheerabala. It is more effective in Mamsa than Asti. But it is also Asti Brahmana, because it causes Mamsa Brahmana. There is Uttara Dhatu Brahmana and thereby causing Asti Brahmana, but it is more effective in Mamsa Dhatu initially. And Ksheerabala is a God-gifted miracle to the poor and downtrodden patients, and any patient with Mamsa Gata Vata. That being said, it is not only for poor patients, it is also for Any patient, even rich patients who have regular wear and tear, like army people who used to jog 10 kilometers per day, like people who do excessive treadmill, people who do excessive cycling, people who do gym and they put on heavy weights for thigh muscle workout and they have severe tenderness. The first medicine that has to come to your mind is Ksheerabala 101. In fact, in our college, we used to have sports days for continuously 3 days. And the first day they used to have 100 meter running and long jump and sprint and 400 meters, etc. The next day they used to have a football match or cricket match. So sports day is almost 2 to 3 days. And in the pre-warm-up sessions, our athletes, Ayurveda doctors, used to massage Ksheerabala, heat Ksheerabala thailam a little, and used to massage Ksheerabala and cough muscle. And after coming back from the ground, and they used to massage Ksheerabala, and they had surprisingly very good strength, and it helped in their athletics. So such is the strength of the Ksheerabala. So now coming to what can be the Anupan of Ksheerabala. I always choose Anupan of Ksheerabala to be warm water because Ksheerabala is frankly Shita Gunadravya. It is capable of causing ama, it is capable of causing pratishaya in certain patients, right? It is when not given properly, you don't check the tongue of the patient properly, you don't check the digestive power of the patient properly, you give Ksheerabala, you may end up in trouble. So Anupana, best Anupana to give along with Ksheerabala is hot water. And always, most of the time, 99% of the time, Ksheerabala goes along with Ksheerabala. Sahaushadhis you can add whenever you are prescribing Ksheerabala. You can also add some form of calcium supplement like Prabala or Riasto, Asti Poshak, whatever calcium supplement you can, and you can also take it along with Ksheerabala. And you have to give Asti Dhatu Brahmana. You can choose Maharasnadi Kashayam with Ksheerabala. When you want Ksheerabala to get digested properly to the patient, you can choose along with Dhanvantram Guliga. When you think I am going to give Ksheerabala to this patient and this patient is going to get a cold, you can give Talisadi Guliga along with the Ksheerabala. Kaisharagulu Talisadi Ksheerabala can be a combined prescription. So before choosing Ksheerabala, one has to properly know about the status of the Agni for the patient and how Prakriti also, how often they catch cold, etc. Just one thing to be kept in the mind. So today we are going to see about Gandha thailam. In last video, I have explained in detail about the benefits of Ksheerabala and where to use an exact specific condition as to how to give Ksheerabala to the patients. Today, we are going to discuss about Gandha thailam and the difference between Ksheerabala and Gandha thailam and what and when should be administered both. So, what is the main difference between Ksheerabala and Gandha thailam? Imagine a patient coming with you who is doing hard physical activity, strenuous physical work. Imagine you are a doctor who is working in village or suburban area where the dominant patients are doing excessive physical activity, thereby degeneration and thereby Dhatukshaya, causing the Vata Prakopa, causing the knee pain. So Dhatukshayat Vata Prakopa, the first medicine that has to come to your mind is Ksheerabala. So now where to give Gandha thailam? You already have Ksheerabala and Dhatukshaya Vata Prakopa. Gandha thailam you choose in such patients who is having mild to moderate to severe obesity. Because of increase in weight, there is bone degeneration and the patient does not do strenuous physical activity. The patient is having a sedentary lifestyle and the Vyadhi and other conditions where the Vyadhi is specific to Asti Dhatu. Because they are overweight, patient is overweight, because the patient is having Kaphavarana, thereby Vata Prakopa, thereby bone degeneration, you should automatically choose Gandha thailam. So this is the specific distinction between Ksheerabala and Gandha thailam. Those who work hard, those who does not work hard, Dhatukshayat Vata Prakopa, Avaranat Vata Prakopa, one is not having cholesterol, one is having excessive cholesterol. So this is the place where you have to choose these two specific particular drugs. So another condition is when the patient is having fracture. Does not matter which patient it is. When the patient is having Bhagna Roga, whether he is obese or Krisha, does not matter. Gandha thailam should be first drug of choice. Not choosing Gandha thailam in fracture is a crime because it is an excellent Asti Dhatu Brahmana. So, coming to our Ksheerabala, for that sake, is not very specific to Asti Dhatu, unlike Gandha thailam. So, how is Gandha thailam prepared? What are the contents of Gandha thailam? In Gandha thaila, mainly you have sesamum seeds, tila seeds, which are soaked in water for 7 days and taken out. And then it is soaked with a mixture of Eshtimadu Kashaya and milk for 7 days. Why it is soaked in water for 7 days? Why it is soaked in Eshtimadu Kashaya plus milk for 7 days? Because tila is extremely Ushna. So to pacify in Ayurveda, always a drug will contain an aggravating agent and a subsidizing agent. If there is something that increases Ushna, there will be always a counter-affecting drug within that medicine not to give the side effects. So similarly, because to neutralize the tila, Ushna Viryatha of the tila, it is soaked in water for 7 days and it is soaked in Eshtimadu Kashaya and Shira for again another 7 days. And it is also mixed with Padmakadigana and Eladigana and a lot of Prakshapaka Dravyas like Rasna, Durva, etc. And it is with all this combination, taila is made and Gandha Thailam soft gel capsules or drops are prepared. So, in spite of doing all this, in spite of pacifying the Ushna Viryata of Tila this much, the Gandha Thailam drops or capsule is still Ushna to the patient. Still, it causes urinary tract infection to the patient who are already having gastritis. It will increase gastritis. So, you have to be very chooseful, very highly cautious while choosing Gandha Thailam. I always prescribed Ulcerex tablet of Charak company along with Gandha Thailam because it has some pacifying property. It neutralizes the Ushnata of Gandha Taila, or you can also choose Gulichadi Kashaya along with it, or Bala Gulichadi Kashayam and Kamaduga Mukta tablet, anything of your choice to pacify the Ushna Viryata of the Gandha Tailam. The benefit of Gandha Taila is that it does not need much Agni for the patient to digest because it is given in Avarna, because it is given in the patient with rich ama, with cholesterol, etc. Where there is extremely high ama like fever, Gandha Thailam should not be given. But normal ama, with patient with normal ama, Gandha Thailam will not increase the will not decrease the Agni so much like Ksheerabala. That is why Ksheerabala, the side effect of Ksheerabala is that it is difficult to digest. That is why we give it with Dhanvantram Guliga and Talisadi tablet. The side effect of Gandha Thailam is that it will increase Ushnata to the patient. So that is why we are prescribing some pacifying agents or anti-ulcer agents along with the Gandha Thailam to neutralize the Ushnata of the Gandha Thailam. So coming to contents, the Tila is the main content here. What is Tila capable of doing? It has excellent cholesterol reducing capability. Whenever you go 20-30 years back in villages and all, when the patient is having PCOD, when the lady is too much, when a woman is not menstruating for so much time because of PCOD, when she is overweight, the only thing, the main things they will ask to take are Tila and papaya, Ushna Virya Dravyas like that. Why they advise that? Because it reduces fat, it reduces cholesterol, it increases metabolism, thereby it corrects the cycle, it reduces the PCOD, and then thereby increasing Ushnata, causing the proper menstrual bleeding from time to time. In fact, Tila Modaka is given daily for that cause. And we have medicine called Tila Rasayanam in Ayurveda we give to PCOD patients. So the crux of this thing is, it has an excellent cholesterol reducing property. It has excellent Kapha Varna reducing property. It has fat burning capability. So that is why Gandha Thailam can easily surpass directly to Meda Dhatu Agni. When you take Ksheerabala, it has to be digested, go on to Rasa Dhatu, Rakta Dhatu, Mamsa Dhatu, Asti Dhatu. Mamsa Dhatu, Medo Dhatu, and then Asti Dhatu. But Gandha Thailam is not like that. You take it, it has capability of directly acting on the Meda Dhatu Agni, giving the Brahmana to Asti Dhatu. That is its Prabhava. It can directly act on Asti Dhatu. Why else it would be given in fracture? In first day of fracture only you give Gandha Thailam. How can it create a bone Brahmana? Because by Prabhava of it is Asti Janana property is there in Gandha Thailam. So, you should understand how Kapha Varna Vata patients come. Okay, you can take an example of a dam where one side of the dam is full and the dam gate is closed, other side of the dam is dry. Why the other side of the dam is dry? Because the water is accumulating on the other side. One side, the gate is there, only when the gate is open the water can reach the other side. Similarly, for the patients of obesity, for the patients of Kapha Varna, there will be all the nutrition in their world, there will be all the weight in their world, but it won't get proper digestion. They will have sedentary lifestyle, they will have impaired Medo Dhatu Agni, their metabolism will be so low that the nutrition does not reach, because of the ama, the nutrition does not reach Asti. So such is the exact condition where you choose Gandha Thailam, where it gives miraculous results. So you choose it in Kapha Varna Vata Prakopa. So in fractures, along with I big time I am using Gandha Thailam along with Mustadi Marma Kashayam, Lakshadi or Kaishara Gugulu, and Murivanna for external applications. This is commonly used. This is the place where I use Gandha Thailam along with all these adjuvant medicines. In knee joint pain, I use Gandha tailam. When the patient is coming, the patient is having not if the patient is having shofa as a main symptom, I choose Rasna Saptakam, Amruta Guglu or Gokshura Guglu and then Gandha tailam according with it. If the patient does not have much of shofa, I choose it with Maharasnadi Kashayam, Ksheerabala Guglu, Gandha tailam, etc. So it depends on the patient, along with the calcium supplements, external applications, etc. In frozen shoulder or cervical spondylosis or in any urdhva jatrugata vyadis, I choose Gandha tailam along with Ashtavargam. Why Ashtavargam? Ashtavargam Kashayam is excellent in increasing blood supply to the particular part of the body. It will make sure that the Gandha tailam is specifically reached over there. So I choose it, and it has some urdhva jatrugata properties. So I choose it with Ashtavargam. For example, a frozen shoulder patient comes, I choose Ashtavargam Kashayam tablet, Ksheerabala Guglu Gandha tailam. Some cervical spondylosis patient comes, I choose Ashtavargam Kashayam, Panchamrita Loha Guglu and then Gandha tailam. So such kind of choosing along with the adjuvant medicine according to the condition I do. So in calcaneal spur, I give Gandha tailam along with Rasna Saptakam and Gokshura Guglu and some external application. Even in ankle joint pain, plantar fasciitis, I give Rasna Saptakam, Gokshura Guglu, Gandha tailam according to the condition, and I ask the patient to take it for 3 months, and there is excellent results with this. So if any back pain patient comes, accordingly Maharasnadi or Yogaraj Guglu or Gandha tailam, Gandravastadi, Sahacharadi Gandha tailam, anything, but the Ushnata has to be kept in check. When you give severe Ushna medicines like Gandravastadi and Sahacharadi, you need to be very careful, so the patient should not develop UTI or gastritis. And so basically, when cut down to the chase, you have to have 3 fulfillments or 3 requirements to choose Gandha tailam. Number 1, the Vyadi should be related to Asti Dhatu. The Vyadi should be related to bone or joint problem. Then you choose Gandha tailam. Number 2, in Bhagna, you choose Gandha tailam. Number 3, in Kaphavarna. Kaphavarnat Vata Prakopa, you choose Gandha tailam. In Dhatu Kshayat Vata Prakopa, you choose Ksheerabala.